Everyone, so this is my presentation on hearing impairments. Okay, so I'm going to start with the definition of a hearing impairment. The IDEA defines a hearing impairment as an impairment in hearing, whether permanent or fluctuating, that adversely affects a child's educational performance but is not included under the category of deafness. And then the state of New Jersey defines it as an impairment in hearing, whether permanent or fluctuating, which adversely affects the student's educational performance. Something important to note about the definition of hearing impairment is that it is separate from the definition of deafness. Deafness is defined as a hearing impairment that is so severe that the child is impaired in processing linguistic information through hearing with or without amplification. So deafness and hearing impairments are two separate things, even though a lot of the characteristics are the same. And then the picture here on the left is the international symbol of deafness and hearing impairment. The two qualities that are measured to assess a child's hearing are number one, frequency, which is the vibrations measured in vibrations per second, and intensity, which is the loudness, which is measured in decibels. I also included the two main tests that can be done to assess hearing impairment. The first one is the air conduction auditory method. This one is usually done at the pediatrician, um, at the child's yearly well visit, and this is when earphones are placed over the child's ears and they raise a hand when they hear a sound. Then the bone conduction audiometry method is usually done by the school nurse, and that's when a vibrator is placed on the forehead so the sound can bypass the outer and middle ear and go directly to the inner ear. The most common one is the air conduction audiometry method, but the other one can be done as well. There's also a few different types of hearing loss. So the first one is conductive hearing loss. That occurs in the outer or middle ear and prevents sound waves from traveling to the inner ear. Then sensorineural hearing loss is caused by damage to the inner ear, hair cells, or auditory nerve. Mixed hearing loss is a combination of both of the types that I just mentioned, conductive and sensorineural hearing loss. And then lastly, auditory neuropathy spectrum disorder occurs when sound enters the ear normally, but sound is not organized in a way that can be understood by the brain. That one's not as common, but those are the four main ones. So the first section of developmental characteristics that I'm going to talk about is cognitive. Cognitive function is not impaired all that much. It's very similar to those of normal hearing children, provided their innate communication capabilities are acknowledged and capitalized upon. This is where the parents and teachers have a super important role in helping the children capitalize upon their innate capabilities. Um, they the hearing impairment can have an effect on the psychomotor communication and language acquisition skills. And psychomotor, by the way, means the relationship between cognitive functions and physical movement. The hearing impairment can also affect balance, time-space structuring, and in some cases, the organization of the central nervous system and motor skills. It can have an effect on vocabulary, sentence structure, speaking, and academic achievement. They learn concrete words more easily than abstract words. They may have problems understanding words with multiple meanings, and they usually produce shorter and simpler sentences. Um, all of these disabilities and delays can be recovered by overall improvement of hearing. None of these things are permanent. They can be helped with rehab or work with a therapist. So the next section of developmental characteristics that I'll talk about is social. Obviously, language is a communication tool, so the hearing impairment can make it harder to make conversation with others. Because of that, children may just not want to talk to or play with other kids because it's too hard and stressful for them. As a result of this, they report feeling isolated without friends or unhappy in school. A lot of the social problems are more common in general education settings. I'm not exactly sure why. I think it's probably because students with more profound hearing loss are in more secluded settings and they don't feel the effect as much of being isolated because they're around kids with similar issues. Um, Also, underlying causes may be linked to communication challenges and potential language delays. It's not common, but autism can develop due to the lack of social interaction. So that's where it's super important for parents and teachers to make sure that their child is getting the proper social interaction, as hard as it may be for their child. The next section is emotional development. Um, Emotional development can be challenging for children with hearing impairments. A range of mental health problems have been found to be associated with hearing loss, including depression and anxiety, aggression, oppositional defiant disorder, and conduct disorder. Behavioral problems may accelerate at home or in school due to difficulty with hearing. Children with hearing loss may have trouble articulating their feelings, which obviously makes them feel frustrated and may lead to aggression, really any of the mental health problems that I mentioned. Also, needless to say, they often have a lack of confidence, which can lower their self esteem, which can really take a toll on their emotional health as well. Even if it is diagnosed, wearing a hearing aid or undergoing medical care often makes children feel isolated and different. So that's also a cause of the depression and anxiety. A lot of times, children will try to downplay their hearing impairment and not really tell parents, teachers, doctors the full extent of it because they don't want to have to wear a hearing aid or appear different to their peers. Physical function is not really impaired as much either, aside from the actual problems within the ear, depending on what type of hearing impairment they have. Two things that have been found to be associated with hearing impairment is clumsiness and problems with coordination. Again, two things that can be treated and helped with therapy and rehab. Um, However, if left untreated, physical consequences can occur. They're not very common because most of the time the hearing impairment is caught, and as long as the parents and children are willing, it's treated promptly. But if it's not, some things that can occur are tiredness and exhaustion, headaches, vertigo, tense muscles and stress, eating and/or sleeping problems, stomach problems, and an increase in blood pressure. Okay, so strengths and challenges. Some strengths that are associated with people with hearing impairments. Number one, they're very adaptable. A lot of times they have no choice but to think outside the box and think of new ways to make things work when they can't rely on their hearing. Um, so that's something that not a lot of people have the capability for because they're never forced to do it. Um, that being said, they rely heavily on other senses. They're good at reading body language. I thought that was really interesting because body language is something that normal hearing people often ignore because they just rely on what a person is saying. But hearing impaired people can't always rely on that. So they're actually good at reading what people really feel, regardless of what they're saying, based on their body language or how they're presenting what it is that they're saying. Um, like I said, they cannot rely on their hearing completely, so they're very detail oriented. They take good notes and pay attention carefully, again, because they have no other choice. Um, However, there are a lot of challenges associated with hearing impairments. It can be hard for them to communicate with people in everyday conversation. In school, it's one thing um, because the school staff and their peers are kind of aware of their issue, so it's easier for them to make things work in school. But accommodations are not readily available outside of school in the normal everyday life where people don't know of their issue. So that's definitely a challenge. Um, they often feel inadequate when drawing attention to their hearing problem. Like I said earlier, a lot of times children will just downplay their issue or try to get away with not wearing their hearing aid or not doing their treatments because they don't want to feel different. They have trouble getting their message across due to limited vocabulary. Bullying when others become aware of the child's differences. So, if they do wear a hearing aid or if their problem is treated, unfortunately, they might start to feel isolated and sadly get bullied. Also, they experience anxiety and stress because it is hard for them to communicate. It's hard for them to just go about everyday life and deal with a lot of things that normal hearing people take for granted. Also, they often feel misunderstood. Their hearing issue may be mistaken for laziness or inattention when people don't really know what is wrong with them. So some supports in the classroom that I came up with. Number one, seat the child close to the front of the room or wherever I'm speaking. That way they have as best a chance as possible to hear what I'm saying. Provide notes that recap each lesson so that they can go over it at home and not worry about getting every little detail in class. Also, minimize background noise in the classroom, such as heaters or air cooling systems or whatever it may be, fans. Keep the door shut to keep noise out that comes from the hallway. Provide closed captioning for audio and video learning so that they can have something to read instead of just hearing it. Wear a special microphone that is linked to an earpiece for the child. That's a special device that I'll talk about on the next slide. Then socially, I would create activities where students work in groups. That way, the child with the hearing impairment is forced to work with the rest of the students and vice versa. Explain the child's needs to their classmates with their permission. As long as they're comfortable with it, I could explain to their classmates what it is that they're dealing with and that they're not that different and what they can do to make it easier for their friend. I would also give the option of another student presenting oral work for them to kind of take away the stress and anxiety of having to give an oral presentation to the class. So, some resources for a child with a hearing impairment. Number one is a personal frequency modulation system, FM. That's what FM stands for, frequency modulation. What it does is it sends the teacher's voice from a wireless microphone worn by the teacher through frequency modulation radio waves directly to a small receiver worn by the student with hearing loss. And that can be worn by students with or without cochlear implants and hearing aids. Then number two, something similar to that is a sound field system. And that sends the teacher's voice from a microphone to one or more speakers mounted on the wall close to the child. So the difference is that the child doesn't wear anything. They just sit close to a speaker that helps them hear more clearly. This is helpful if you have multiple students with a hearing impairment in your class because it can be used by more than one student at once. And again, this can be accessed with or without cochlear implants or hearing aids. You can also connect the student with a speech-language pathologist. The speech-language pathologist will provide a screening and a plan of action for the student. They will establish augmentative and alternative communication techniques, speech and language intervention, select, fit, and establish effective use of adaptive devices, and much more. Speech-language pathologists are a great resource for children with hearing impairments. There's also many organizations and agencies that help students with hearing impairments. As with all other disabilities, um, they target specific needs of children with the specific disability. One specific to a hearing impairment is the Alexander Graham Bell Association, and that's an information center on hearing loss, emphasizing the use of technology, speech reading, written and spoken language, and much more. They provide support and advocacy for parents, professionals, and the students themselves. Interpreter services are also an option for more severe and profound hearing loss. Many students use an interpreter to help them understand what is being said in the classroom. The interpreter often sits right next to the student, close to the front of the classroom. There are two different methods which are often used together. The interpreter often uses a combination of both. The first one is oral, that's when the interpreter mouths what is being said, and the second is manual, that's when they sign what is being said, using American Sign Language. These are some pictures of the resources that I just talked about. So on the far left is the personal FM system, the middle is the sound field system, and on the right is just the logo for the Alexander Graham Bell Association. This video here on top is a story about a girl who participated in early intervention and how that paid off for her. And that is a great video to watch.